I thought cancer was caused when body cells that are old, damaged, which are supposed to be replaced by new cells, continue to grow. Is that also a thing that causes cancer? Sorry, my science is quite poor.
No, it's okay. It's not poor, actually. We actually talked about this in the beginning where we said cells normally divide and grow. That's why we all grew up, but sometimes they grow out of proportion. And Dr. Abdulazeez rightly said that they can metastasize, move from one body part to another. And in addition, they could invade. That is, they will remain where they are and actually invade structures like blood vessels, like nerves. So the characteristics of abnormal cellular growth that defines cancer is the ability to invade or metastasize, meaning to invade is just the English word invade, then metastasize is moving from where they primarily are to distant parts in the body. So if a cancer is in the leg, it can metastasize to the brain, for example, which is quite far from it. So, and this metastasis is done by the blood vessels, the lymphatics, thereabouts. So invasion and metastasis following an abnormal growth of cells is what defines cancer. Normally when cells grow, they age, they actually die. It's a scientific process. But when they become abnormal, then they continue to grow, meaning it is no more the normal growth of cells aging, then maybe their senescence or death, either by apoptosis or whatever. So it's, shall I say, it doesn't follow that pattern of normalcy, and then it grows disproportionately and then invades and metastasizes, and then cancer is said to happen. Thank you.
If I may add something to that, I think where the question's coming from is old cells that's supposed to be replaced by new cells. That's not completely distinct from what Dr. Aisha has said quite rightly. I think what the basis for that question is that normally as we go through life, the body has ways of doing what we call surveillance. It looks for cells in the body. So your immune system looks for cells in the body that are damaged and gets rid of those cells. Because as cells grow and divide, sometimes you have errors in the DNA as cells get duplicated. And the body is actually able to pick up those abnormal cells and remove them from the system, whether they're damaged from just accidents or environmental influences or whatever. Now, sometimes those mechanisms fail, and we believe that that's why in patients who are immune suppressed, so patients who have HIV or patients who have had transplants and have to have immune suppression, this process doesn't go on as it should. And we certainly know that the proportion of certain kinds of cancers in these patients is higher than the rest of the population who have normal immune systems. So it's one of the ways by which, cancers can develop, but it's not the only way. And, like everything else in science, it is dynamic. We're finding new things. In fact, there was a presentation at a huge conference just yesterday that kind of changes the way we see lung cancers develop, and that's evolving science. So, we're learning more and more about these things as time goes on. Thank you.